Dr. Manish Bansal. I am Senior Director in Clinical and Preventive Cardiology at Medanta, the Medicity, Gurgaon. See, when I was doing my MBBS or even MD, at that time the main source of information for us used to be books. Whatever was there in the books, that is what we were practicing. And because of that reason, I don't remember having applied any new information in my clinical practice during those days, because as we know, books have a lag of 3-4 years. The situation now has changed completely in opposite direction. Today, if we do any internet search, we will come up with answers which may not be accurate, because there are so many dubious websites also. So now the students have to face dual challenge. On one hand, they have so much information, they don't know what to use and how to extract the relevant information. At the same time, they are also not sure what they are accessing is accurate or not accurate. See, if we have a point of care solution which can provide relevant information in a very succinct manner, which is simple to follow and is accurate, it can be a big help to all clinicians regardless of their seniority status. You can access all the required information in a jiffy at the patient bedside without struggling through number of long databases or long articles. This will definitely make it a lot easier for everyone. In India, we know that there is a huge patient load compared to the number of doctors that we have. So every doctor is burdened heavily with the amount of clinical work that he or she has to do, which makes it very difficult to access any resource while managing the patient. So when we are in the OPD or IPD, our immediate goal is to just see the patient and give instructions. If we are stuck somewhere, we don't have time to access any relevant information. But if we have a point of care solution which we can access very quickly and which can give us required information very fast and at the bedside, that will definitely make it easier. Our decisions will become more accurate. We will be able to practice evidence-based medicine more regularly, more often. Elsevier's Clinical now, which has been developed, it is a very, very good solution. It has got many good features. It has information which is arranged in a manner which is very easy to follow. So every information is in the form of bullet points, no long paragraphs. It is broken down into relevant sections. There are practice algorithms. There are quick view snapshots which give a gist of the topic in few seconds. Then there are integrated medical calculators, drug monographs, guideline recommendations. It has been developed by Indian experts who have been practicing in India for many years. So they are aware of the challenges that we face in day-to-day clinical practice. So because of their expertise, that kind of practicality has got reflected in the content that is there in this product. Yeah, I did browse some of the topics that I had myself contributed, and I was really impressed to see how the topics and various subsections were interlinked with the similar information for the same disease in other specialties. So for example, if we have a disease which is multi-system disorder, I have written the cardiology aspect, someone else has written nephrology aspect of the same disease. So in the app, it is all interlinked. You can easily have an overview of that disease without much difficulty. You don't have to go to nephrology section because everything is interlinked. So that was one very good thing. Practice algorithms were easily accessible, which as I said, I found them very useful. And drug monographs. That is another challenge that we clinicians face in India. Lack of information about various drugs that are available. So this product has drug database which is specific for India. So that is another very good thing which I found.